Bismillahirrahmanirrahim. I am going to do discussion on the topic of Hodgkin lymphoma. Hodgkin lymphoma, it is the most common carcinoma of young adults and adolescents. Young adults and adolescents. Now, Hodgkin lymphoma. It is characterized by the presence of the neoplastic giant cells. And these neoplastic giant cells, they are called the Reed-Sternberg cells. It is the characteristic malignant cell of the Hodgkin lymphoma. Reed-Sternberg cell. And this Reed-Sternberg cell, it produces the various factors which causes the accumulation of other cells like T cells, macrophages, eosinophils, granulocytes. These are all. And these other cells, they almost make more than 90% of the tumor cellularity. Now we discuss about the WHO classification of Hodgkin lymphoma. There are WHO classification Hodgkin lymphoma. There are 5 subtypes of this Hodgkin lymphoma. The first is nodular sclerosis. The second is mixed cellularity. The third is lymphocyte rich. The fourth is lymphocyte depletion. And the fifth is lymphocyte predominance type. The first 4 varieties, they are called the classical Hodgkin lymphoma because in these the Reed-Sternberg cells, they all has similar immunophenotype. In all these varieties, the Reed-Sternberg cells, they have similar immunophenotype, whereas in lymphocyte predominance type, the Reed-Sternberg cells, they have a distinctive type of immunophenotype. That's why it's called non-classical, whereas the first 4 are called classical. So I am again repeating the WHO classification. Nodular sclerosis, mixed cellularity, lymphocyte rich, and lymphocyte depletion, which are called the classical, and the 5th one is lymphocyte predominance type. Now we discuss about the morphology of this Hodgkin lymphoma. We will mainly focus on the Reed-Sternberg cell. The Reed-Sternberg cell, it is a large cell with multiple nuclei because it is a neoplastic giant cell tumor. So the Reed-Sternberg cell, it is a large cell and containing the multiple nuclei. Or it could be that there's a single nucleus but having the multiple lobes. And each lobe has its separate inclusion like nucleolus. Okay, and there is abundant cytoplasm is present. Okay, abundant cytoplasm. So I am again repeating that what is the morphology of Reed-Sternberg cell. The Reed-Sternberg cell, either it contains the multiple nuclei in a single giant cell, or there is a single nucleus but it has multiple lobes, and each lobe has its own inclusion like nucleolus, and there is the abundant cytoplasm. Now we discuss about the variants of the Reed-Sternberg cell. There are other variants, that different types of the Reed-Sternberg cell. The first is the mononuclear variant. This mononuclear variant, it contains a single nucleus and a large inclusion like nucleolus. The second is the lacunar variant or lacunar cells. These lacunar cells, they have a folded nucleus and there is the abundant cytoplasm, pale abundant cytoplasm, and this cytoplasm, it is washed off during the staining process and during sectioning. So it looks like that during staining, after the staining, the nucleus is sitting in a hole. There's a hole which is called, that's why it is called the lacunar cell. Hole, that is lacuna. The nucleus is sitting in a hole or lacuna. And these lacunar cells, they are the characteristic of the nodular sclerosis variety. We discussed the four subtypes. The main was the nodular sclerosis, and in that variety the lacunar cells predominate. And the third variety is the lymphohistiocytic variant. What is that? Lymphohistiocytic variant, and it is mainly present in the fifth variety, that is the lymphocyte predominance type. These Reed Sternberg cells, which are although the characteristic of Hodgkin lymphoma, but they could also be present in other conditions like infectious mononucleosis, like large cell Hodgkin lymphomas, diffuse large B cell lymphomas. So they should be, whenever you find the Reed Sternberg cells, then you should exclude these other conditions like infectious mononucleosis and large cell non-Hodgkin lymphomas. Now we discussed about the nodular sclerosis, the subtype of the Hodgkin lymphoma. Nodular sclerosis. In Hodgkin lymphoma, about 65 to 70% of the cases, there would be the nodular sclerosis. Now we discuss about the characteristic histologic features. There are four main characteristic histologic features. As the name indicates, that there is the nodules formation, and sclerosis mean fibrosis. So there is the in the lymph nodes, the collagen is present, and in the lymph nodes the collagen is deposited in the form of bands, multiple bands. So it imparts the lymph nodes are nodularity. That's why it is called nodular sclerosis. And second, the fibrosis is present, which may be scant or abundant. And the third is that there are the lacunar variant Reed Sternberg cells are present, and in the background, the more than 90% of the cellularity, it is formed by T cells, eosinophils, macrophages, and plasma cells. So what are the four characteristic histologic features? The first is the nodularity of the lymph node. Due to deposition of the collagen in bands, the lymph nodes is in the form of nodules. The second is the fibrosis, which is scant or abundant. The fourth is the lacunar variant Reed Sternberg cells are present in these lymph node, and there are the more than 90% the T cells, eosinophils, and macrophages are present. That's all about the Hodgkin lymphoma. Thanks for joining.